So, Stephen Houlahan.
That's me.
So, how's it going? How's your day?
Well, Eric, I can't complain. I live in San Diego, and San Diego is America's finest city. And it's great to be here with you, on this wonderful, glorious day.
Yeah, so let's just get right into it. So, you are a nurse, right?
I am. I've been a registered nurse for, wow, over 25 years now.
Wow.
Time flies.
So, I have something to ask you. Is the US healthcare system broken?
Wow, that's a complex question. Well, let's put it this way: there are portions of the country that are underserved, and there are portions of the country where the healthcare system works quite well. However, it is a bit overpriced. I'll tell you that. It's very expensive to get health insurance in the United States. And with the overturning of Roe versus Wade, some states have almost no health care for women who are, trying to seek that very specific type of health care for, prenatal care, sometimes postnatal care, and also the care they may need if they need to terminate a pregnancy. So there are portions of this system that are absolutely broken.
Yeah, so, I've actually looked into this. I've just started to vote in 2016. That's when I was actually introduced into politics. Before then, I had no idea what was going on between the parties, between Republicans versus Democrats. And something that was introduced to me early on was Bernie Sanders' proposal for universal health care. And that's actually what drove me into politics. And I had no idea about any of it before. But what is your opinion with universal healthcare versus the system that we have in place right now?
That's another great question. So I believe that we need to eventually, incrementally get to a universal healthcare system. However, we tried it back in the 90s and it failed, and we haven't done anything really since. We have Obamacare, the Affordable Care Act, which is a huge success, and we could do so much more. So I actually have two proposals. My first proposal is to immediately expand Medicare to cover everyone who's 55 years and older, because when you hit your 50s, like myself, that's when things seem to start kind of going wrong. That's when you may start having issues with your heart. That's sometimes when people start having issues with cancer and these sorts of things. So we could all agree, I believe, whether you're a Democrat or Republican, whether you want one payer or not, that we could expand Medicare immediately for those 55 and up. My other proposal is called Medikid. And so, if we could do this Medikid program and cover all children, we shouldn't have to donate money to St. Jude's, hospital to cover children who have cancer. And when a child develops cancer, it's from no cause of their own. It's not like they were smoking or doing drugs or or whatever. They just were the unlucky children who had an abnormality of some sort and developed cancer. So we should be covering children, providing all that preventative care, and also it will pay for itself, believe it or not. And then as we move forward, I believe that as we cover all the kids, then as they age and when all the 18-year-olds or the 17-year-olds turn 18, cover them and work your way up. And so that way, over time, we incrementally develop that one payer system. Because I don't think we're going to get a big agreement in Congress where we're just going to do it. So I'm trying to do what's best, and eventually we would achieve it.
Yeah, no, I totally agree with that. And, the problem that we're having right now with two parties is that it's either my way or the highway. It's either all of it or none of it. And that's coming from both parties. So your proposal, to do it incrementally, it's a pretty good proposal. And, bringing in people into this system now, an argument that we hear a lot is that universal healthcare will be more expensive. It sounds good, but it will be more expensive. But if we move from that, if we transition from a private healthcare system into universal healthcare, although the cost upfront may seem higher, the long-term cost may actually be lower. Wouldn't that be?
You are absolutely correct. The long-term costs will be lower, and that is proven throughout the industrialized and modern world. And so other countries have done this. It works, and it makes sense. It makes sense economically, and it can be done. So, and you know what? In the United States, whether we have a divided government or not, we actually can do things. And so, and that's why I'm running for Congress, because I want to be a pragmatic problem solver, not somebody who's just running to enrich myself. In fact, it wouldn't enrich me at all. So what I want to do is do the right thing, and expanding Medicare, creating the Medikid program, funding the Affordable Care Act, and making sure that, say here in California, what's called Medi-Cal is fully funded. It actually makes financial sense. And so when people have catastrophic health conditions, it can lead to bankruptcy. It's one of the primary causes of bankruptcy, and towards the end of your life, it could lead to homelessness. And so again, and we have a homeless crisis across the country, especially here in California. We have an affordability crisis, and so it makes sense. And so yeah, you are absolutely right, Eric.
Yeah, and talking about homelessness, a huge issue about homelessness is that a lot of homeless people suffer from mental health. So this will actually be beneficial to solving our homelessness problem in the long term.
That's correct. That's correct. And not everybody who is becomes homeless had a mental health problem that led to homelessness. But that is one of the causes of. There's a number of causes. But once you become homeless, you likely will endure a mental health crisis because of the gravity and the magnitude of what has occurred. And so that's why it's so important to provide those services, and to make sure that we're taking care of people's physical health and their mental health and their emotional health. So absolutely, it's really that important.
Yeah, and another issue is actually substance abuse that we see homeless people suffer from as well.
Another great point. And it's sometimes you wonder, is it the chicken or the egg? Was it the substance abuse? Did that lead to them being homeless, or did they become homeless and begin substance abuse? Regardless, I believe there's both of those are probably likely. Some people use drugs and they burn every bridge with their families, with their friends, and eventually become homeless. They don't have those systems of support. And then some people become homeless, and then they're introduced to these sorts of things. So and that leads to the whole idea of this fentanyl crisis. There is an issue with fentanyl. As a registered nurse and a critical care nurse, we use fentanyl when you have surgery. It is a very, very strong pain reliever. And so we would use fentanyl. I never would have believed that this would be a street drug. And so we need to deal with this as well. And first of all, we need to save people when they overdose. We need to put Narcan out there. We need to be able to reverse that issue of what happens when you overdose and you become apneic and you're dying. But also, we need to stop it at the source. And a lot of fentanyl is coming through the border here in San Diego. And we need to make sure that we have the equipment and the manpower to deal with that. They talk about a border crisis, but unfortunately, our Congress was unable to act. And so that's another one of the issues. All these issues intertwine. The homelessness and the fentanyl issue are intertwined, and the mental health crisis. All of these things are intertwined, Eric.
Yeah, so it's like a huge issue that, there are many proposals that we could actually put in place, but one proposal, if successful, could also lead to the benefit of other issues that we're facing. So taking it back, so you've been a nurse for 25 years, so right at the turn of the century.
Believe it or not, I know it seems like yesterday to me, but to you young folks, that you might have been in diapers back then.
No, yeah. I mean, I was born in '94. You started practicing medicine in '99.
I graduated from nursing school out of San Diego State University in 1998.
Oh, wow. And what actually made you get into medicine?
Well, interestingly enough, and it's healthcare. I'm not a physician.
Right.
However, at one point I did aspire to become a physician.
Mm.
However, college debt, even back then in the 90s, to become a physician would have been pretty massive for me. I didn't have I didn't have that financial backing to become a physician. However, I actually became an orderly in a psychiatric facility and started learning about healthcare, and then eventually worked my way to as a mental health worker, working in the hospital, and then eventually as a nurse's assistant in a large hospital. And I learned by watching what other people did. And becoming a nurse, which was, somewhat controversial for a man back in the 90s, was one
Yeah.
of the best decisions I made in my life. I'm proud to be a nurse. I was able to overcome any stigmas, and it was okay. And so here we are, 25 plus years later,
Yeah.
and I'm still proud to be a registered nurse.
So you know what goes on with our healthcare system because you see it as
I
you know.
do. I do. I'm an expert not only in the healthcare system as a critical care trained nurse and a trauma trained nurse, but I actually am an expert in Medicare. I'm actually an expert in it. I'm a coding specialist. I'm what's called a senior specialist for a large healthcare organization, which I guess I won't name just because of who knows, but here
Right.
in San Diego. And I am very, very attuned with healthcare finance.
Mhm.
And so, yet another reason why I feel that I'm very well equipped to run for Congress and serve as a congressman. And I actually went back to get a master's degree in nursing. So I have a master's degree in healthcare systems administration as an MSN. I also have an MBA.
Mm.
And so I did achieve those back in 2003. And so again, I actually have the brick and mortar knowledge. I graduated out of the University of San Diego back in 2003 with those two master's degrees. And you know what? I understand student debt as well. I had a significant amount of student debt,
Yeah.
and believe it or not, I just paid it off uh, this year. This
Mhm.
year, so I was able to pay it off on my own. Although I do support helping and a lot of the current administration's plans to help those with student debt, I do support that. But I was actually able to pay my student debt off myself.
Yeah. So what's your position with tuition-free college?
Well, I benefited from community college. It was a huge benefit, and I was able to pay for community college while working. But it was a challenge. It was a challenge even back then. Minimum wage was very low in the 90s. It's
Yeah.
too low now. It's too low now. And so I believe that community college could be subsidized to a point where it is free or very, very close to free. The same with like San Diego State University. When I went there, I was able to pay for that, but I worked every weekend. And so I didn't really have the same college experience that I hope my son has because I'm going to support him through college. I wasn't going out to football games and all that. I worked and I went to school. And so I believe that we could provide subsidized schooling. However, the one thing that I would say is when things are free, sometimes people don't value them as much as well. So there is something to be said about hard work as well. But
Mhm.
I think that we could provide subsidies for those who have, certain that meet certain criteria, whether it's grade point average, whether they don't have the support of family, and those sorts of things. So, but it is complicated. I don't think that we should carte blanche just give away everything. We can't just give away the farm.
Yeah, that's true. If you give it away, some people may not value it as much as if someone actually paid for college. I just graduated. I actually graduated from Cal State Long Beach, And in 2020, so for the for the first half of my college, I actually went to a community college, which helped a lot. The second half of it, I just finished in Cal State, and I took a portion of subsidized loans and a portion of subsidized loans because it's an issue that although it's true that if you give it out for free, some people may not value it, but it's an issue that's getting out of hand, and college is just becoming too expensive. And a lot of students who go into college not necessarily know what they want to do. So not only are they taking out a loan, but they're also taking out a loan and they don't know what career they want to take. So
I agree. I agree, Eric. And the issue is college has become a money making endeavor for many colleges, and that's not okay. And it's in like the University of San Diego. I don't think I could afford to go there today. The price has gone up astronomically, and so what I would say is you have private colleges, and you have like state and public schools, that are somewhat public, and so I think there should be limitations on how quickly they can raise tuition at community college, at state colleges, like the San Diego State University system, the UC system here in California. There should be limitations, like you went to UC Long Beach. A bit expensive, definitely. But then there's these private colleges. If you're private college, if you want to pay, then God help you with it. But we need to make sure that we have the capacity with the state universities so that people can aspire and achieve. But there are these other universities where it's like people are basically purchasing degrees. I think that they need to clamp down on some of that stuff.
yeah, we do see a lot of that happening. And moving on to a different position that you have. So you have a position with renewable energy and expanding our energy infrastructure. So I just had Sari Dominguez. She's running for California's 37th State Assembly District. And, she opposes a little bit the about closing down our oil plants, or the Diablo Canyon to be specific. That plant is in her district, so she opposes a little bit of that. So I want to hear the other side of the argument, to see if there's a middle ground between closing down the current plants and expanding the energy infrastructure.
Great. That's a great question. So what got me into I was an activist before I ever ran for office. And down the street from my home, there was plans for a what's called a peaker plant. And it was going to be run by natural gas. And they were saying that it was clean and et cetera, et cetera. And if they wanted to put it in the middle of a park. And when I learned about it, which is a park, Mission Trails Regional Park here in San Diego, that park's near and dear to my heart. And I was, just going out there mountain biking one day, and I saw a sign. Someone had written a sign, no power plant. And I thought, well, there's a landfill over there. They got to burn off the methane that comes from the decomposition. It makes sense to have a power plant there. But then I learned that there already was a power plant there doing that they wanted to put a second power plant. And so then I started learning about it, and it was not a good plan. And so I founded an organization called Save Mission Trails, for which I'm still the president of Save Mission Trails. And we went to all the local municipalities, and we were able to rise up as a grassroots organization and a grassroots movement. This was back in 2012. And we were able to unite Republicans, Democrats, independents, everybody. And we actually were able to stop them from building this power plant. But you know what? We didn't stop it because of emotion, and we didn't stop it because we just didn't want power. We wanted to go back to the Stone Ages. It was not a good plan. And so what ended up happening is we were able to stop this power plant from being built because it was in a park. Everyone agreed they didn't want that. But also because in San Diego, it is sunny like 364 days in the year. We're lucky. Like when we get rain, it's a blessing, to tell you the truth. And they were saying, well, it doesn't, the sun isn't always out. Well, that's true. That's true. But you know what happened this summer? We had the hottest summer ever, but we had expanded over the decades, or over the past decade, solar. And so I have solar on my house. My electricity bill is nothing. I actually get paid a little bit back due to what's called net metering. And I went to the schools, the high schools, they put in solar panels in all the parking lots. And I tried to do it as a city councilman here in Santee, for us to do similar thing, which I wasn't successful in because of politics. Sometimes people make bad decisions. But what also happened here in California is we put up battery backup all across the state and distributed. And so there was no time during this whole hottest summer ever, during any heat wave, where we were asked to use less electricity. Now, that is a much better solution, because when you have solar all day long, and then you save some of that electricity in batteries, and then in the evening when the sun goes down, those batteries, they run the system, they run the grid. And so we can do it. And then what you do is you don't build the new power plants. You don't need to build them. And in fact, here in San Diego, the San Onofre nuclear power plant had closed down quite a number of years ago, maybe a decade now. But yet we never had any shortage of electricity. So we actually can do this. And so potentially you're out in Las Vegas. It is sunny in Vegas, man. There was days when it was unbearably hot. And so again, there's no reason that you can't have solar on every parking lot in Vegas with battery backup, and there's no need to build any more power plants that put out fossil fuel emissions. We are in a climate crisis. It is happening. A massive hurricane just destroyed a large portion of the big, they call it the Big Bend in Florida, near Tallahassee, and went all the way through Georgia up into the Carolinas. So we can't just keep doing the same thing. It's insanity. Here in California, we had massive, and still have massive, wildfires going on. Again, if we just continuously belch out all this carbon into the atmosphere, CO2, the Earth will eventually become inhospitable and inhabitable for the younger generations. I will probably, maybe not be around for that, but that doesn't mean I don't care. And so, the older generation needs to learn how to care. We need to care about the younger generation. And so, that, I hope that answers your question, but we can.
Right. Yeah, another argument that they like to claim is that renewable energy, or electric vehicles, use energy from not clean sources. I mean, but the thing about that is, once we actually start going into electric vehicles, we will be able to find a way to make everything clean energy, because there's so many different things that go into that. Getting our energy from sources that are not very clean. But I believe that we could figure out a way to make all energy clean energy.
Absolutely. And those are, people are naysayers about this, but you know what? We're doing it. And so when, my employer put solar on the parking structure for which I park, and then put in chargers. And so there's a whole floor of it, one of this four-story parking structure, one whole story is all chargers. So it can be done. And I always use this story, and back in the Roman times, they used to have chariots. So, I bet when they came up with like a better wagon, the people that were the chariot makers said, well, how could you possibly do something more than a chariot? But you know what, we moved forward, and then we had, wagons, and then eventually, we had automobiles. And before that, we actually had public transit that they removed, believe it or not. Mm-hmm. So we absolutely can move forward. And so some people just lack vision, my friend. Some people simply lack vision.
And they may actually be afraid of change.
It can be. And I'm not saying that that there's not a place for cars that use fossil fuels. I don't want, like, say a fire truck. I don't know that we can replace every fire truck with an electric fire truck right now.
Mhm.
And so I want them to be able to respond. Or maybe law enforcement, I don't know, maybe they can use electric cars, but at this point, maybe, they have to burn fossil fuels. However, like for city government, we could easily transition a lot of the city vehicles over to, using electric vehicles and be able to charge them through having moved to solar. And it would save a huge amounts of money in these local governments. And so, you just have to have the vision to move forward.
Mhm. And not only that, it's also convenient because if you have the uh, um, the vehicles for the city, right? You could charge them overnight and without actually having to go to the gas station and possibly wasting time like that. It's just convenient that you could get charged anywhere there's electricity.
Exactly. So yeah, it's the climate crisis. The Earth will still be here. By the way, the Earth doesn't end. The Earth, it'll still be here, but we'll have this mass extinction of animals and creatures. Pollute the ocean, pollute the air, and it just won't be the same quality of life. And so what we need to do, and which we've done in my hometown, which is, I'm running as a Democrat, and it's a very red area. But you know what? People know that I have a track record of success, and there are people that actually will cross party lines and vote for me because they know that I've done the right thing. And so again, it's about being a pragmatic problem solver. It's not about the tribalism of being one party or the other. And a lot of it, we haven't even talked about economics. It's about doing the right economic thing. If it costs $1 billion or many billions of dollars every time a hurricane slams through Florida, and then my homeowner's insurance goes up to where I can't afford it, then the climate crisis does start to matter. Whether you feel like you're insulated from it or not. And so a lot of people don't understand we're about to experience an insurance crisis. And so what's happened in Florida today, those people have insurance. They may have the same insurance carrier that I have, that you might have. Cars were flooded, boats were destroyed, homes were destroyed, and the insurance company needs to make a profit. And so what they're going to do is distribute that cost across the nation and raise each and every one of our homeowners insurances, our car insurances, everything. And so, the bill is starting to become due. And so we have to act. Otherwise, it'll get to where we can't insure our own homes. And guess what? If you can't insure your home, you won't get a mortgage. You will never own a home if you can't afford insurance. And so, we have to act. We have to, and we can still do it. I'm very optimistic.
Yeah, I mean, it's happening already. Some homeowners are being unable to insure their houses due to house fire or due to wildfires that are happening in California.
That's correct. But you know what? If you don't outright own your home, and then you will not be able to have the mortgage. And without the mortgage, without insurance, you will not have a mortgage. You will lose the home. And so, people should be forced out of their home because of the inability to pay for insurance. And so, as a congressman, I would like to subsidize people's insurance and that's really important because what we do right now is we send in FEMA and people live in trailers, and then that's it. And then move on to the next catastrophe. They're happening too often. I think there's another hurricane off the coast of the Atlantic right now, already bearing down on the eastern seaboard. So we have to make sure people are insured. We have to not be part of the problem, and we have to make sure, because if you lose your home, you may become homeless. You may become you may have nowhere else to go.
Yeah, and it's all due to uh, things that are just out of people's control.
You know what's in people's control? Voting and thinking about it. And so people need to think about what they're voting for. They need to think about it. And a lot of people are just very tribal. They look and they see an R or a D, and they just vote straight down the ballot. They're not really thinking about it, or they don't want to think about it. The younger generation, they simply don't vote. And when you don't vote, you give away the only true power you have. And so I would urge everyone, get out there and vote. I have my opinions, you may have yours. But you know what I do believe in is a peaceful transfer of power. So we may sometimes move a little bit to the left, we may sometimes move a little bit to the right, but we must progress.
Yeah, because at the end of the day, they're just ideas, that we're both trying to fight for. And if we are able to discuss these ideas without just fighting each other outright, we might actually get to solve some of the problems that we're facing.
Absolutely. Absolutely. And, right now, things are just stalled at the federal level. That doesn't help anybody. Luckily, they did not shut down the government. And so, at least the government is funded through the election. That's what Congress is supposed to do. They have to do they handle the purse strings of the nation. And so we need people that actually care, that actually have vision, and that actually have skills to go to Congress. Because some of the people there right now, I definitely disapprove of.
Yeah, well, it was great having you come on, and thank you for coming on and discuss your proposals.
Absolutely, Eric. Thank you for taking the time. Thank you for everything you do, and congratulations on having recently graduated. Great to hear that. And if anybody wants to reach out to me or learn about me, they can go to my website, electhoulahan.com. I'm on Twitter, Elect Houlahan. I'm on Instagram, also Elect Houlahan. I'm on Facebook. Just look for Elect Houlahan. And if you can't remember that, for some people, they remember MASH. For the older generation, Nurse Houlahan, I am a nurse. Or for people who are a little younger, maybe you remember Dodgeball, Patches O'Houlahan. So hopefully I can make you guys laugh a little bit, and hopefully you can learn a little bit more about me in the future. So thanks again, Eric.
Thank you.